My name is Lena Hall. I'm a family nurse practitioner student, and today I'm going to be performing the peripheral vascular examination. So first, I'm going to start by inspecting the patient's arms from fingertips to shoulders. So I'm going to be looking at the patient's nail beds, which they are pink in color. There's no flaking, even color distribution, and the patient has symmetry arms. They're the same length, same color distribution. No swelling is observed. Um, and then I'm going to have the patient flip their arms over, and I'm going to inspect the patient's arms for venous pattern for prominent veins. There's no prominent veins observed on either side of the patient's arms. Go ahead. Now I'm going to assess the patient's legs. I will be looking at the patient's legs for the hair pattern is evenly just distributed on both sides, even pattern, no baldness, irregular patterns. The patient's nail beds are pink in color. There's no skin flaking, no swelling observed. Now look at the bottoms of your feet. There is no sores, no calluses, no flaking. Color is even, no swelling of the feet or ankles. Okay. No uneven pigmentations, no rashes, scars, or ulcers were observed. I'm going to check the patient's capillary refills. Okay, less than 3 seconds. All right. Same with the feet, with the toes. And the capillary refill on the toes is less than 3 seconds also. Now I'm going to perform the Allen test, which is I will take the patient's wrist and turn it over, and I am going to press down on the ulnar and the radial arteries. And while I'm doing this, patient will make a fist and then open, and I will release one. Okay. Other side. Okay. And there's even distribution of the coloring when the arteries were released, which would be a negative test. Same here. Okay. All right, negative test on that side. Good. Now I'm going to assess the patient for arterial insufficiency of extremities. So I'm going to have the patient lie supine. And then I'm going to elevate the patient's legs 60 degrees until the foot palor develops. That's usually within a minute. And then the patient will sit their legs down and dangle their legs on the side of the bed, and you will wait for the color to return to the feet, which normally is less than 10 seconds, and the filling of the veins of the feet and the ankles is less than 15 seconds. Okay. Now I'm going to palpate the radial arteries. Okay. And both radial arteries are +2, and now I'm going to palpate the patient's brachial arteries. Also +2. Good. All right, and now I'm going to palpate the epitrochlear nodes, which I'm going to have the patient make a 90-degree with their arms, and then I will be going in 3 centimeters from the medial epicondyle between the bicep and the tricep muscle. I will feel the epitrochlear nodes. Okay, and I will do it on this side. All right. And I can feel the epitrochlear nodes, palpate them on this side also. Okay, now I'm going to don my gloves, and I am going to palpate the femoral arteries on both sides. With my 2 fingers, I'm palpating the femoral arteries. And then I'm going to palpate the popliteal. Okay. And then I'm going to palpate the dorsal pediis. And then I'm the posterior tibial pulses. They are also felt. Okay, and now I'm going to palpate and note the temperature of the legs. They are warm to touch. No moisture felt. There's no edema that I've noticed, but if there was edema, I would test for pitting edema, and I would press the skin for 5 seconds and wait for the skin to rise and see how long it takes, and I would note what the pitting edema was, if it was +1, +2, +3, +4, +5. And you can do that over tibia or in the foot also. In the shins and in the foot.